My name is Laya Aoho from the Africa Research and Impact Network. I'm a research associate with a legal background and the policy lead on the knowledge translation framework. We are here today in Moshi, Tanzania for a validation workshop with the policymakers from across the region. So we are really here to engage the policymakers to find their views. How can research and evidence inform future pandemic response, and what lessons and learnings can we draw from the COVID-19 experience?
We see a lot of opportunities in terms of collaboration between researchers, program managers in our region from the various East African partner states, because as you know, the EAC always work with the partner states, and we want to give information which is accurate, which is updated, and in the health sector we normally have experts meetings, and we need during the experts meeting from the various partner states to always use clear evidences. So as such, we need the participation of researchers, participation of program experts, and from there we need to come up with some good reports with clear updates and up-to-date information.
The communication which we've been talking today is very important for policymakers at the region, because as you are aware that we have a new member state, the DR Congo. We are now more than 300 million people. So communication is very, very important. How can we communicate to have a very effective communication from the grassroots level? We have been discussed about this issue, and is the involvement of the community, but also at the policy level, just to make sure that the researches that we are carrying out, they are also in line with the treaty that established the East African Community, the East African Development Strategy, and then you zero down to the development strategies of the partner states. And the language which can be used is when we involve the community, the people there. We have the structures and systems that which we can include them when we are doing our research, and also when we disseminate our results. We make sure that we involve them so that the language, although we may have a technical language, for them they will give us the language which they understand. And that is where they can, own the findings of our researchers and working towards improving their livelihood.
And mostly, I like the presentation in the morning about situation analysis, which shows me that mostly it is important to know the situation in each country, which is important because once you know the situation, you know how to move forward. I wish this meeting, at the end of the meeting, all the deciders at each partner state can receive the information and the message that has been spoken here, so that they can be using the same information to implement or to decide at which level they can help the deciders to take a decision in terms of managing health problems in country. Yeah.
Community engagement is really, really important combating any kind of pandemic. Also, multi-sector engagement, another component of importance when you're combating any kind of pandemic, because every partner and every institute has its own capacities. So when you join hands, you'll be able to combat such kind of issue. And then the dissemination of research findings is really important when you're combating any kind of pandemic, because having some information in the cabinets is not really important, but disseminating the information to stakeholders and community is really important to bring changes for future pandemics.
It affected the region very much. The context of climate change, the issue of the financing was one of the gap, because partners, governments, the EAC, the credit itself, most of the funds went to addressing the challenge of COVID-19. and leaving now the interventions of climate change unfunded. So that was a big challenge, as financing is a key to climate change into the region as well. The second is that the decision making, climate change works at the international level. We could not meet in 2020 to have decision through the COP26 in Glasgow. So that one left us also the challenge, the gap that we could not monitor the implementation of the agreed resolutions and the decisions on climate change. What also, as a region, we witnessed that no new partners were coming in, because they had also the challenge of the COVID-19, and they give us the challenge now to enhance our partnerships first to address climate change challenges, but as well as the partnership with sustainable development CBTA.
We have seen that the COVID-19 pandemic has taught many things, lessons, and the East African Health Research Commission has taken that challenges as an opportunity. And first of all is that there is a directive from the Council of Ministers to which the East African community were directed to do research on the COVID-19 and also to advise the community on the way forward. So one of the areas which we have done is that we are establishing a regional East Africa disease surveillance and control. That is, we want to integrate partner states' early warning system to be interoperable, but also to be real time, that when there is an outbreak to one of the partner states, they can share information in real time so that they can put a mechanism for rapid response to contain the pandemic before it is spread to the other part of our community.
There is a gap between research dissemination and the policymakers, linkage between research and the policymakers. There is a gap, and there is a need to make any assessment on different areas for researchers, and to ensure that policymakers they are receive any recommendation to make any changes on issues that are rising as a problem.
What has really come out is the need for science and policy gap to be filled or to be bridged. Another aspect that we have discussed in depth is the need to involve communities, even as we look at a proper knowledge translation framework that has been co-created with the policymakers from across the region.